and the frame in place, we are able to identify the best target entry for entering that brain abscess to minimize the type of surgery the patient has and also to be as very accurate as possible.
Dr. Konasevich successfully drains a large amount of pus from Meredith's brain. But Meredith is still in danger of having a relapse if the doctors can't determine what's causing the abscess and treat it.
I had contacted the infectious disease doctor, Dr. Linda Vanetta, who I had asked to look carefully at the microorganisms and/or bugs that were potentially causing this abscess in the brain.
Usually a brain abscess is due to one or more bacteria. We will look at what the reason why the patient might have one, pending our culture results.
Dr. Vanetta rushes to the microbiology lab to study the sample Dr. Konasevich has extracted from Meredith's brain. Soon after, Meredith emerges from surgery.
I remember seeing my mom and seeing a friend and waking up and I just remember being so confused as to what was going on and what had just happened.
When I first saw Meredith, there was a real sense of relief, I guess, because I was physically seeing my child finally after having her endure all these things.
For the next 24 hours, Meredith is closely monitored.
Aspiration can lead to effective cure along with the antibiotics. I was very hopeful that it would be able to do that in Meredith's case.
But Dr. Konasevich won't know for sure if he has to do another surgery until he sees how Meredith is responding to treatment. For the time being, it's a waiting game.
I was feeling a little bit better, a little bit more with it, but not full. I mean, there was still something wrong with me. It was still progressively, it was kind of standing still, but not getting any better.
Meredith had a very good Sunday. She had a visit from her sister and brother and father, so that was a very good meeting. But on Monday morning, we were greeted with a visit from Dr. Konasevich.
Meredith started complaining of increased headache and still had some word-finding difficulty. A repeat CAT scan at that time showed expansion of the abscess and evidence of increased swelling of the brain. So the next step for Meredith at this point meant undergoing a left craniotomy.
A craniotomy involves removing a portion of the skull bone and operating on the brain tissue beneath. The bone is replaced at the end of the surgery. It's a risky procedure and can result in seizures, brain damage, and even death.
Well, Meredith was very brave and courageous, but she did say to me several times, "Mommy, I'm really scared." And I assured her that she had every right to be scared and that I was scared too. And to hear that your child is scared is just a very difficult thing when you're just so scared yourself.
For a better-looking tomorrow. Vicks NyQuil Cold and Flu. The nighttime sniffling, sneezing, coughing, aching fever, best sleep you ever got with a cold medicine.
1, 2, 3, 4.
Vicks DayQuil defeats 5 cold and flu symptoms.
There's a science to the perfect swish. It's about zero weight, 100% more nourishment, which means hair that's not weighed down. Introducing new Aqualite from Pantene. Our lightweight conditioning formula nourishes, then rinses clean in seconds, leaving hair perfectly conditioned to swish. New Aqualite collection from Pantene. Nourishment with zero weight. Pantene. Hair so healthy it shines.
With Swiffer Wet, cleaning better doesn't have to take longer.
I'm done. I'm gonna use these.
Unlike mops, Swiffer can maneuver into tight spaces without the hassle, and its wet mopping claws can clean better in half the time, so you don't miss a thing.
Mom? No, it's Mommy.
Swiffer, better clean in half the time, or your money back.
Life is full of little tests, but your Basic paper towel can handle them, especially if that towel is Bounty Basic, the towel that's durable and scrubbable. In this lab demo, Bounty Basic is stronger than the leading bargain brand. Everyday life? Bring it with Bounty Basic, affordably priced, tested by Everyday Life.
Did your sofa collapse from sagging springs? It's impossible to get up. Now get instant sagging sofa support with Furniture Fix. The difference will amaze you. The panels lock together for...
Home is where the heart is.
There's nothing better.
And when Giada's home, her heart's in the kitchen.
The recipe's in your head, I know.
Old ladies give them to the young ladies, and then life goes on.
Oh, yeah. I love it. It doesn't get better than this.
Giada at Home, Saturday morning at 11:30 on Food Network.
Brought to you locally by Soft, Delicious Bimbo Bread. It's packed with goodness and baked with love.
This is the big one. The one Hollywood holds its breath for. Where stars become star-struck. And nothing you expect to happen happens the way you expect. E! is live from the red carpet at the Academy Awards. Sunday, February 26th, starting at 2 Eastern, 11 Pacific, only on E!
Get to Nissan now for the offer you need on the Nissan you want during the Nissan Now sales event. Hurry, event ends soon. Visit ChooseNissan.com or your local Nissan dealer now.
What he drinks, I just want to do what he does. Damn it, I didn't come to work.
Are you ready?
I'm gonna do it!
All leading up to this.
Oh my God! Oh no, oh no!
Oprah's Next Chapter, tomorrow, 9/8 Central, only on OWN.
2 weeks ago, Meredith Estes was healthy and excitedly planning for her freshman year of college. Now, she's about to undergo her second brain surgery in 5 days.
I think that when your child has to undergo brain surgery, you just wonder all sorts of things, if they're going to be ever the same.
At 8 a.m. on Tuesday, neurosurgeon Stefan Konasevich makes his first incision.
The abnormal portion of the brain in Meredith appeared to be discolored. Also, there had been evidence of some underlying pus that had emanated from that part of the brain. I was able to excise the majority, if not all, of the abnormal appearing brain. After having done this, I was able to close back the covering of the brain and put back the skull and sew back the scalp.
I just remember feeling a lot better and feeling almost like there was like a load off my shoulders. Like I just felt like I was me again.
And she wanted 3 things. She wanted apple juice, she wanted water, and she wanted chocolate milk. And very adamant in her delivery of those demands, I knew that I think I was getting my child back.
But Meredith is far from out of the woods.
There was still an underlying concern because Dr. Konasevich conveyed that this bacteria may still be there, and there would be follow-up tests and MRIs done to gauge whether the bacteria growth was enlarging or whether it was fading away.
A month since all of this began, the results of the culture arrive.
It was 3 or 4 days later when we had the final cultures back with Fusobacterium. Fusobacterium is what we call an obligate anaerobe. It's a bacteria that only can grow without the presence of oxygen. That's why Fusobacterium tends to be in abscesses.
Based on the presence of the Fusobacterium, Dr. Vanetta is able to give a name to Meredith's malady.
She had Lemere's disease.
Lemere's disease is a complication of a severe sore throat caused by a particular kind of bacteria called Fusobacterium. It occurs when the Fusobacterium cells that cause the initial sore throat spread to form a blood clot in the jugular vein. Pieces of the clot then break off, infect the blood, and travel through the bloodstream to form abscesses in other parts of the body.
Pus can metastasize through the veins and can go to the brain, can go to the lungs, can go to basically any part of the body and cause this metastatic sites of infection. And that's how Meredith's infection spread.
Fusobacterium can be found in most people's gastrointestinal and oral tracts and is usually harmless. But for an unlucky few, the bacterium can cause a life-threatening infection.
Fusobacterium is a very rare infection to have, It's reported and felt to occur less than in 1 in a million patients. And if untreated, her risk of dying in a matter of a few days would have been very great.
They told me that it had affected my temporal lobe, which affected my memory, which explained a lot.
Because it can easily be treated with antibiotics, like polio, Lemierre's is considered a disease of the past. Many doctors have never even heard of it, making it difficult to diagnose.
Lemierre's syndrome is kind of called the forgotten disease because of the fact that it used to occur fairly frequently prior to the days that we had very effective antibiotics.
But the rise in Lemierre's cases in recent years is troubling to many infectious disease doctors.
Because there is this emerging concern in the United States that we are overusing antibiotics, we have been encouraging our physicians in the United States to not use antibiotics in a needless situation. And I think it's because we have stopped using antibiotics so freely in the setting of a sore throat. We are starting to see more cases of Lemierre's syndrome emerging now in the last decade.
Once the bacterium is identified, Dr. Vannetta immediately designs a treatment regimen for Meredith.
She received 6 weeks of intravenous and oral antibiotic treatment.
They put a catheter in to my side, and every day I would have to insert 4 different liquids in it. And I told my friends about that, and they're like, oh man, that really sucks. And I was like, well, no, it's not that big of a deal. Like, after all else of what I had gone through, like, it was like the smallest thing.
By the next fall, having completed the antibiotic regimen, she's fully recovered and ready to start her sophomore year right.
Meredith is great today. She is a university student, doing well in her studies, and has a very spunky nature to her. She does not complain of any headaches. She doesn't have any visual problems. Her speech is intact. Her memory is also very good.
You can't tell that she had brain surgery at all. She's a really good student. She's still really energetic and optimistic and fun to hang out with.
Well, Meredith today is just amazing. I really admire her courage, her determination, her resiliency. I think she's made a remarkable recovery, and I think that she's really come a long ways from those dark days in the hospital.
After having Lemierre's, it seems like little activities that one takes for granted, like I appreciate a little bit more because I'm able to appreciate them. Like I'm able to do maybe what some people that had it aren't able to do because they're no longer around.
Meredith was hit so fast and hard with her symptoms, she didn't know what was happening to her. But Doug Posluszny was agonizingly aware as his body mysteriously began to fall apart.
The first time that I felt something was wrong was the last Saturday in February of 2004. And I went to go get a haircut, and when I was driving, I started getting kind of lightheaded and flushing and sweating and getting some chills. And, you know, I started having some lower back pain.
Alarmed by the unexpected symptoms, Doug cancels his appointment and makes his way over to his girlfriend's house.
Doug looked terrible, pale, he was sweaty, he was hot to the touch. He looked like he got run over by a train. I took his temperature, it was 103.
Michelle insists that Doug go to the local urgent care facility for a complete workup.
It was late in the day, Saturday. Right before they closed, they squeezed me in. They did me the favor. And, you know, when I got there, they checked me out. They saw my temperature was over 103. And, you know, they did a urinalysis.
The results show blood, protein, and a large amount of white blood cells, which indicate Doug's body is fighting off an infection.
They told me I had either like a bladder or a kidney infection.
He's given antibiotics and sent home. After a few days, he begins to feel better. And by the end of the week, Doug is back to his old self. But then, just a week later, he experiences another alarming incident.
Michelle and I were driving to a wedding about a half hour into the ride. I just started feeling strange. I started flushing. I just started, like, my face, I felt like blood rushing to my face. I felt like I was getting, like, red in the face. And I started getting, like, dizzy. And, you know, within about 10 or 15 minutes, I was pretty disoriented. And, you know, I was holding my head. I had a lot of pain in my head.
I was talking to him, and he just seemed really spaced out. It was in his eyes. He was looking at me like he didn't know who I was, and he just seemed like he was on another planet. I got scared, and I said, well, maybe we should go to the emergency room.